Hey y'all, my name is Brianna. I will be discussing the postpartum family development theory today. So, first, to quickly discuss what a middle range theory is and how it's important to nursing practice. Middle range theories, compared to other models, are more specific. They focus on a specialized practice area with the information that they provide, making it specific to certain areas of nursing, which is nice. Especially for me as a mother baby nurse, we don't typically see things like standard med surg nursing sees. So having studies more geared towards mother baby and postpartum is really nice. So the theory that I'll discuss, the postpartum family development theory, relates to me as a postpartum nurse because I spend 12 hours of my shift attempting to develop a family dynamic by allowing moms and fathers and other family members to bond and cope with the new baby, mothers and fathers to bond and cope with their new role as parents. So I believe that this theory best fits my nursing practice because my hospital policy does require me as a mother baby nurse to screen for postpartum depression. We even ask for help at home, what their family dynamic is like, just to ensure that they are adequately cared for once they leave the hospital. So the theory also relates to my practice because we want mothers to feel like they are adequately prepared to go home, and how their families are interacting with them is an important part of that. So the next question, the four meta paradigms of nursing. So those are person, environment, health, and nursing. So the first one, person, is recognized through my theory by recognizing that adapting to the parental role for mom and dad is not easy. New mothers especially are coping with potential traumatic birth experiences, even possible like NICU stays, pain, no sleep, psychosocial changes. There's a list. But they're struggling with that. So trying to ensure that they are cared for as a person is important. The environment is addressed by addressing potential negative environmental factors. So whether that's the father of the baby unfortunately not being around, what their home life is like. Do they even have somewhere for the baby to sleep? Things like that. And the meta paradigm of health is addressed by understanding that postpartum mothers' mental health is just as important as their physical health, which I think is something that not everyone creates such a large focus on, and I like that this study did. So the theory addresses that mental health concern by researching what a home visit after discharge would do for the family, how they would be affected, would it be positive or negative experiences. Unfortunately, there is a study that does state that postpartum depression affects the mother and the baby. Things like poor breastfeeding, depression, alcohol and drug use, relationship and the family problems, all kind of stem from postpartum depression. And the last one, nursing, is implemented into the theory by providing research on how a public health nurse would play an important role in the postpartum family transition, those home visits. How would that benefit that family? Luckily, the study showed positive experiences from home health visits postpartum, which is really nice. And just real quick, to focus on one meta paradigm, I think that it's really important that the health portion is addressed and focused on here, just because mental health is so important for postpartum moms. So the last question, but the concepts in this theory. So there were two that I found specific to me and how I care for my patients every day. The first one, of course, which I kind of focused on the last question, is postpartum depression. According to another article that I cited, women and infants are discharged within 2 days post-delivery if there's no complications. And they're just expected to go home and cope with their parental role. And that's not always the easiest, especially if resources are lacking. So they're discharged 2 days after they deliver, and they're not seen by their OBGYN until 6 weeks postpartum, which is a long time for them to struggle with, mental health or family concerns, things like that, social concerns. So even though they're seen in 6 weeks, typically providers only focus on the physical health portion. They don't focus on that mental health side. which is why I think this study was important to me, because it discussed how home visits postpartum and, post discharge would benefit them. Another concept that this theory focuses on is family development and how new parents feel about their role as a whole, how they're coping, how they're adapting, what demands do they have that could be addressed, things like that. So this directly influences the patient care that I provide, because patients are always assessed postpartum for during their hospital stay. We try to ensure that they're adapting to all parental roles, but the biggest one is breastfeeding. So according to a study that I researched, parents expressed concern for breastfeeding by saying that they found breastfeeding very hard at the start of their journey. So if we don't, as postpartum nurses, help them adapt to that, they'll never succeed, and that can, cause a variety of issues for them. So knowing this type of information makes me, as a postpartum nurse, conscious about the education and advice that we provide. We want them to adapt to that role if that's what they choose to do. So I believe that that's really important. So to kind of finish off, I know I'm kind of like a little bit over the time, but I believe that as nurses, we should assist with adapting to this parental role and, keeping the family involved, just to ensure that the parents and their, journey with a new baby flourishes. Oh my God, I can't speak. So anyway, thanks for watching. Bye, y'all.